Hypertrophic cardiomyopathy, often abbreviated HCM, is one of the most common inherited cardiac diseases. In patients with obstructive physiology, accurate measurement of dynamic left ventricular outflow tract obstruction is essential. Today, two leading experts, Dr. Dermot Phelan and Dr. Matthew Martinez, discuss new research shaping how we evaluate obstruction, research they helped author. Their work highlights why goal-directed Valsalva is rapidly becoming the preferred method of gradient provocation, particularly for patients on cardiac myosin inhibitor therapy.
When we think about evaluating obstructive hypertrophic cardiomyopathy, provocative maneuvers are central. Traditionally, the instructed Valsalva, basically telling a patient to bear down, has been widely used. But despite its ubiquity, it's fundamentally inconsistent. Patients vary tremendously in how effectively they're able to strain, how long they can hold it for, and the pressure that they can generate. In our study, we want to examine whether a standardized, reproducible method called the Goal-Directed Valsalva could provide a more accurate physiologic challenge. Goal-Directed Valsalva requires patients to sustain an intraoral pressure of 40 millimeters of mercury or more for about 10 seconds. This creates a predictable and measurable preload reduction, and what we found was unmistakable. Goal-directed Valsalva consistently elicited higher LVOT gradients when compared to an instructed Valsalva.
We also looked at goal-directed Valsalva in our JACC Advances study, which reinforced these findings on a broader scale in patients undergoing treatment with mavacamten. These are the patients where accurate gradient measurement is not simply academic, it directly affects medication dosing. We observed that goal-directed Valsalva produced significantly higher peak LVOT gradients when compared with self-directed Valsalva. This is a significant difference as it is clinically meaningful because it does change the dosing. What was particularly important was how these gradients changed patient classification. With goal-directed Valsalva, more patients met criteria for obstructive physiology, and when obstruction is obscured by an inconsistent maneuver, patients receive inappropriate dose reductions or unnecessary follow-up imaging studies.
Typically, 20 millimeters of mercury for medication decisions can be the difference between continuing a dose, reducing it, or even increasing therapy. In our study, 8% of cases would have undergone different dosing decisions if goal-directed Valsalva had not been used. That's nearly 1 in 10 patients where management would have been misaligned with their physiology. This isn't just about measuring a number, it's about treating the patient in front of us with accuracy and confidence.
Cardiac myosin inhibitors represent one of the most important therapeutic shifts in obstructive hypertrophic cardiomyopathy we've seen in decades. But with these therapies comes the responsibility to measure the gradients precisely. Our studies demonstrated that goal-directed Valsalva prevented unnecessary dose reductions by avoiding the false reassurance of low gradients produced by self-directed Valsalva. This helps patients stay on optimal therapy, reduces the cycle of repeated echocardiograms required by all those dose adjustments. Essentially, goal-directed Valsalva supports smoother clinical journeys, not just better data, but fewer interruptions in patient care.
Given the simplicity and reliability of goal-directed Valsalva, and the clear evidence from both of our labs and from others, I believe that goal-directed Valsalva should be considered the default provocative maneuver in patients with hypertrophic cardiomyopathy. It's objective, it's physiologic, and it generates reproducible and clinically meaningful results.
As HCM care continues to evolve, especially with the expansion of myosin inhibitor therapies, techniques like goal-directed Valsalva help ensure that our diagnostic tools keep pace with our treatments. It improves accuracy, reduces errors in dose titration, and ultimately supports better patient outcomes. In short, goal-directed Valsalva isn't just a better test, it's a better path forward for patients.